Hello everyone. My name is Makanga Christopher, and today I'm going to be taking you through digital twin for predictive drug consumption and generative AI for personalized treatment plans. Let's get started. So substance abuse is a global pandemic and it has resulted in consequences for individuals and societies. The rise in drug-related deaths and healthcare costs has necessitated for urgent interventions to mitigate these problems. And existing approaches like traditional methods of rehabilitation have failed to address the complexity of factors influencing drug consumption, for example, demographic variables, psychological profiles, and social influences. So we are proposing digital twin technology, which is a virtual representation of physical entities, and we know that it offers a promising avenue to create personalized profiles that can predict and monitor behavior in real time. So a little background. Uganda has one of the highest per capita alcohol consumption rates in sub-Saharan Africa. And an earlier study found that 39.1% of the children aged between 12 and 24 have used substances regularly. So the study also showed that there is a high recurrency rate and extended recovery periods which affect the socio-economic fabric of society, meaning that this is very expensive to individuals in society, in terms of in social terms and economic terms, and that influenced our idea of the digital twin technology and generative AI, which to address these issues by offering predictive healthcare. And so some of the related works. Uh, a paper in 2021 was written, and this paper is titled Personalized Medicine in Substance Abuse Treatment and the Role of Digital Twin Technology. So this paper explores the application of digital twin technology in personalized medical care and substance abuse treatment. So however, the research neglected the role of personalities in substance addiction. Another paper that was Another paper that was written is Digital Twin Technology in Healthcare, also 2021. And the study showed that digital twins could simulate patient conditions in real time to predict outcomes and optimize treatment. However, the study does not account for treatment optimization. And this is our computational problem. So some of our computational problems include multidimensional complexity, meaning that patient-specific data such as psychological responses, behavior tendencies, and adherence patterns are complex and interconnected. So modeling these real-time dynamics requires handling nonlinear interactions and high-dimensional data. The next computational problem is dynamic adaptation. Treatment plans are required to evolve in response to continuous changes in patients' behavior because personalities, social interactions, and everything keep changing. So to reduce the recurrency rates, we need to evolve the treatment plans basing on the evolution of the patient or individual's data. And then the black box nature of these models in such a way that they do not explain how they come upon some results and why they choose specific features, why specific features are important. So we are trying to address this issue as a computational problem. Some of the proposed solutions, or our proposed solution, is a digital twin technology, which is a virtual representation of physical entities, and then generative AI for personalized treatment plans, and then dynamic adjustments to offer real-time updates, and explainable AI because of the black box nature of the models. So our objectives include developing a predictive model that forecasts drug consumption patterns based on demographic, sociological, and behavior data, and then creating a digital twin system which simulates patient-specific drug consumption scenarios, and to design generative AI models that propose and continuously adjust personalized treatment plans, and to implement explainable AI to ensure transparency in predictions and treatment recommendations. So this is our methodology. We started with data collection. We collected our data from UCI machine learning data repository, and then we went ahead and performed exploratory data analysis on our data. And then we came and we then went to data pre-processing, where we did feature engineering, we balanced our data set, we did feature selection, and we split our data set. And we built a surrogate model. From the surrogate model, we built the digital twin model, and then we trained our model, tested it, evaluated it, and performed hyperparameter tuning. So our data set, as I said, was gotten from UCI machine learning repository, and the data set in our study contains records of 1885 respondents. Features include personality measures and other features like 18 legal and illegal drugs. And then these are the results from our EDA. From our EDA, we discovered that 1884, the data set has a shape of 1884 to 32, and then we had no missing values in our data set. The rest of the results, you're going to look at them from our code. Let me go to our code. Yes, so as we scroll, we discovered that most of the individuals in our dataset were from the UK, and then most of the individuals, as you can see, hold a doctorate, and a few people hold a high school diploma, and just a little bit average. An average number does not hold any diploma, but most of the people are highly educated in our dataset. And then these are some of the features. The features include NSCO, which is neuroticism, ISCO, openness to experience, agreeableness, impulsiveness, sensation seeking, and we can discover that our features are normally distributed. They are centered around the mean, distributed around the mean. And then we discovered that most of the people in our data set were whites. And then from these graphs that show the distribution of drugs, the drugs we have in our data set, like alcohol, amphet, amyl, benzoes, caffeine, cannabis, we discover that for drugs like alcohol, there are more people that have used the drug for over a period of these figures 0 to 6 show from 0 meaning the person has never used the drug, and 6 meaning the person has used the drug for over a decade, 5 meaning they've used for it for a decade, and then 4 meaning they've used it for more than a year, 3 they've used it for over a month, 2 they've used it for a week, and 1 they've used it for a day. So there are more people that have used a drug like alcohol for a very long time than those that have never used it. And for a drug like Amphid, we can see that there are very few people there are very many people that have never used the drug compared to those that have used it for several years. And as we continued, we also discovered that the difference between male and female consumption rate for drugs like caffeine is not very different. As you can see, 688 again is 696. No, not very big a difference. And then alcohol, you can see also the difference is not very big. We also discovered that, as you can see, for ages, uh, we compared drug against age, and we discovered that there are very many people in the age of 18 to 24 that have never tried out the drug, the unfetched drug, compared to those that have tried it out. that have tried it out. And then we also discover that most of the young people have never tried out the drug benzos compared to the adults. And from our correlation matrix, we discovered that most of the people that have used that use mushrooms as a drug also use cannabis. And we also discovered that most of the people that use cannabis also use legal as a drug. And we also discovered that most of the people that use ecstasy use cannabis. So we also discovered that most of the people that use LSD also use ecstasy. And we also discovered that most of the people that use legal also use ecstasy. We also discovered, yes, I talked about mushrooms and cannabis. We also discovered that most of the people that use mushrooms also use LSD drug. So those are some of the results from our exploratory data analysis. And we went ahead to perform feature selection on our data set, feature selection to select the most important features. Sorry. Uh, and we used the recursive elimination method to select the most important features. We handled class imbalance as we saw that there are very many people that have used a drug, for some drugs that have used the drug compared to those that have never used it. And then we discovered in other cases that there are very many people that have never used the drug compared to those that have used it. So we performed SMART analysis on our drugs to balance our data set. And when it came to modeling, we undertook modeling in two ways. We had what we call binary classification. In binary classification, we predicted addiction to a certain drug, every drug individually. And then we also created models to perform multi-label classification, where we predicted addiction to drugs all together at once. Now, these are some of the results from binary classification. While we were predicting addiction to heroin, we used four models, including logistic regression, ridge classifiers, support vector machine, and random forest. And from these SVM and random forests came out as the best models with 98%. And then while we're predicting amphetamine addiction, we still came out with SVM as the best with 90%, followed by random forest. And then when it came to multi-label classification, we still used logistic regression, XGBoost, exploratory classifier, and CatBoost. And then from these models, XGBoost came out the best with 88%. And the explainability from our model, the XGBoost model, we discovered that ecstasy was a very important feature in the data set, and meth was also a very important feature compared to gender. As you saw in our model, we from the exploratory data analysis, the difference between men and women was not very big. That's why you see gender had a very small impact on was not a very key feature in our data set. And then from our sharp results, we discovered that age had a high negative impact on our data set. And then we discovered that country, as we saw, most of the people were from the UK, had a huge impact, and education also had a very positive impact on our data set. So we went ahead to build our digital twin. And when we built our digital twin, these are some of the results from our digital twin. We tested for accuracy of our digital twin, and it scored 88% accuracy. And then we also tested it with the area under the curve. And area under the curve, it scored 93% accuracy. And some of the key features from the explainability, from the explainability, we concluded that there is a high positive impact caused by the drug Aifor compared to, as you still see, gender had a very low impact on our model. Now, when it came to the simulation, we performed an agent-based simulation. This is because we are dealing with individuals in our population, and the fact that agent-based simulations are very good for capturing nonlinear and dynamic behaviors among individuals in the population. So that's why we performed an agent-based simulation, and we use any logic for our simulation, as you're going to see in the let me see. Let me open it. So while in any logic, we defined our features, these parameters, n score, e score, o score, which are our features from the data set, including neuroticism, extraversion, openness to experiences, agreeableness, impulsiveness, cessation seeking, and all the drugs. So we also defined states. An agent or an individual can be in either of these states at a particular time. They have either never used a drug, they are experimental users, short-term users, moderate users, long-term users, or addicted individuals. And when we run our simulation, uh, as you can see, our initial state is that the individuals have never used the drugs before. So let me speed it up a bit. Yes, you see, as time goes on and I speed it up a bit, they keep changing, or the colors keep changing from one state to another, showing that this individual is moving from one state to another basing on the risk of the addiction risk or risk analysis, risk score, based on the different features that we have defined in our simulation. Now, when it came to the generative AI, in the generative AI, we use the GPT-3 model. As you can see, we defined it here, GPT 3.5 Turbo, to generate treatment plans. And in this model, we pass our patient data. Now, this patient data we are passing to the model is from our test data set. We divided our data set into the test and train data set. So the test part of the data set is what we pass into our generative model. We pass it together with the predictions from our digital twin model for each individual, and the probability for the individual to have a particular condition like addiction or no addiction, and the accuracy of the prediction. Now we gave it some context, including the definition for the particular features from the test data set, and what we really want, which are personalized treatment plans. And then when we came to the results, these are the results for patient 1 treatment plan. It says based on the N score, which is 0, so the probability of someone being addicted is 1.0, and it appears that the patient may have a low level of neuroticism, and then it generates the treatment plan. Same it does for patient 2. It says person can do lifestyle modifications such as regular exercises, balanced diet, and what the predicted condition here, as you can see, treatment plan 2, predicted condition 0 is the person is not addicted. So they tell you, since the person is not addicted, lifestyle habits, including alcohol consumption, if they're so it gives the treatment plans, and then patient 3, 4, 5, as you can continue. So that's it from our generative AI. So we continue to the conclusion. So in our conclusion, we concluded that digital twin technology has the ability to revolutionize the existing methods of diagnosing and predicting substance abuse based on individual personalities and demographic features in order to create personalized treatment plans with generative AI. And in the future, we would want to update our digital twin with real-world data as it changes in for every individual in order to perform better predictions. And we would also want to design a graphical user interface for our digital twin in order to make it more visually appealing and easier to use. And we would want to perform advanced hyperparameter tuning for better predictions and accuracy of our model. So these are some of the citations from what we've done or some of the papers we've used in our video. Thank you very much for watching. In case of any comments, you can leave them in the comment section. Bye-bye.